Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN, Healthy World, Healthy Nation, Healthy You. I'm Nancy Valentine, PhD and registered nurse, and this show is dedicated to you, the healthcare consumer. And on some of our other shows, we've talked about caregiving at home, and we're going to expand that conversation today. And let me tell you about our topic title. We're going to be talking about how not to let caretaking take a toll on your health as the caretaker. Special considerations in caring for people with dementia. Now, most of the people that have dementia, 80% have Alzheimer's disease. And so we have invited a specialist in this area who's also a specialist in caretaking. So let me introduce our guest today, Dr. Elizabeth Gonzalez. Elizabeth is a PhD and registered nurse as well, and she is Associate Professor and Chair of the Doctoral Nursing Program in the College of Nursing and Health Professions at Drexel University. And she told me that there are about 60 students in the Doctor of Nursing practice program right now, and some of the people that she's working with, she advises on this whole issue of caretaking. But she has a very impressive background, and she will be telling us some of the things about her background as she discusses this topic with us. But she is, in addition to being chair of the doctoral nursing program, she is president of the Asian American and Pacific Islanders Nursing Association. And I'd like her to come back at some point and tell us about that. I think it's a very interesting presidency that she holds in that association. She's also a member of the Medical Scientific Advisory Board of the Alzheimer's Association, headquartered in Chicago, but she is working with the Tri-State Group here in the Philadelphia area. So I want to welcome you, Elizabeth, to our program today. It's really a delight to have you, to meet you, and to hear about what you've been doing with this important program. She is also heading up a research program that she's going to be telling us about, entitled Enhancing Resourceful Skills in Family Caregivers of Persons with Dementia. So we're going to be talking about the tips, things that you really can take away, practical behaviors that you can practice that are really going to help you in your role. So Elizabeth, let's get started with this whole issue of dementia, caretaking, and if you could tell us about how you even got involved with this area of interest, and then tell us about what we should really be paying attention to.
Okay. When I finished my PhD from NYU, I happened to be invited by a group of researchers at Thomas Jefferson University who was doing an intervention study on dementia.
Okay.
And I submitted a small grant attached to the parent grant through the National Institutes on Aging. And that particular grant was really focused on similarities and differences on African American and Caucasian caregivers of individuals with Alzheimer's.
Interesting.
In terms of coping and resourceful skills.
Okay.
That grant was funded. So it protected me 50% of my time as a faculty to do research when I was at Thomas Jefferson. That really started my trajectory in doing research in this population.
Right, because you saw it was such a need.
Right. And also I think the opportunity to work with researchers after you finish your doctoral education, you're prepared to do research, and I just happened to be, I think, in the right institution at the right time.
Well, that's true. Well, Thomas Jefferson is a great university, so yes, they were happy to have you, and you were also fortunate to be working with them.
Exactly.
So tell us, in terms of stress with dementia, why is this different than maybe some other physical diseases that people have to deal with?
Okay. Well, person with dementia, particularly Alzheimer's disease, it is a progressive neurologic disease that the person's health level changes constantly. So there's tremendous change going on, both in the cognition, the behavior as well as the ability of the person to care for themselves deteriorate over time. So the role of family members or a particular caregiver, family caregiver, caring for an individual with dementia is almost like a process that demands constant, monitoring, and because of the uncertainty that is happening, and that's very stressful for a lot of caregivers.
And doesn't this also creep up on them too? I mean, dementia is something that is gradual and then becomes progressive.
Exactly. There's progressive deterioration, and as the person deteriorates, they lose their ability to communicate what they want, and the caregiver needs to know the person well in terms of what the needs are, and oftentimes that doesn't happen at all, particularly if the relationship between the caregiver and the patient is not positive to start with.
Yes.
So that becomes problematic.
And I think, wouldn't it be true though that for many family members, they sort of feel like they don't even understand this when they're first getting involved with it? I mean, it must be very difficult for people to even adjust to the reality of this.
Right, yeah. And as a matter of fact, on the average, years ago when I was doing my initial study on persons with dementia, it takes approximately 3 years for them to bring their loved ones for consult.
Really?
After the assessment or manifestation of cognitive problems. But that's because there is an assumption by some families and some people that forgetfulness is part of normal aging.
Right.
In reality, it's not. It should be a sign of being alarmed. When you have somebody who can't remember to turn off the stove switch, or can't remember if they did these things yesterday or not, then I think it should be a red flag right there.
Right.
But for so many years, we have focused on keeping that as part of normal aging, or assuming that it's part of normal aging.
I think that's an important tip right there,
Yeah.
because I think everybody forgets and of certain things. I mean, forget where you put your car keys, or forget, did I call this person or not? Have to go back and sort of remind yourself. But that's not the kind of forgetting you're talking about.
No. That forgetfulness that you're talking about occurs in, we experience that when we are overwhelmed with our responsibility, when we're under stress, we forget. So you develop a strategy in terms of not forgetting things. Some people would put a piece of paper on the floor so that they'll always step on it, and that's a good reminder that they need to do something.
I actually do that.
but not these patients with dementia. It's really a different kind of forgetfulness that occurs now and then, and I think it is very important to do early screening right there.
Right. So I think that would be the first tip that I would say from listening to this show that you can actually put into action, and that is you can really be a very good observer as a family member. So you would be able to see the difference between just the usual kind of forgetting that we all are involved in because we are stressed, most people are, and the kind of forgetting that Elizabeth's telling us about, and that is really time, forgetting about what time it is around certain issues, or forgetting really important things like leaving the stove on. I mean, things that could really be very disruptive to a person's life and really have them in danger. I mean, these things are really important things to forget.
Exactly.
So you're saying that for 3 years it takes people to really say, gosh, I think there's something wrong here. So what would happen if, because of our show, people now are much more attuned? What would be the advantage of not waiting 3 years and being able to be assessed a lot sooner?
Okay. I think there are some strategies and drugs that could be used to enhance cognition.
Okay.
There's no guarantee that the drugs that will be prescribed will improve cognition, because it varies from individual to individual. But there are some activities.
Let me just interrupt you, because cognition, that word, not everybody's going to understand that word. Just tell us what that word really means from your perspective.
It is the ability to concentrate, ability to remember things. That's what I mean by the cognitive part of our being.
Right.
And also to be able to recognize objects, name objects appropriately,
Or even people.
or even recognize names, or
Right.
recognize face with names, and
Right.
that kind of
Right.
recognition is very
I
important.
think that's important because that word cognition really means a lot of different things.
Exactly,
Okay.
exactly.
So go ahead. I'm sorry, I didn't mean to interrupt you, but I think it's important that
Okay.
our listeners really understand these words.
All right. Okay. Good. That's a good point, Nancy.
Thanks.
Let me see. Where are we?
Well, we were talking about what would be the advantage of being diagnosed
To
a
do
lot
early-
sooner.
early
And you were
screening.
saying you could get different medications. You
Okay.
could, maybe there would be some other interventions.
Right.
Like
right.
what? What would
Some studies that are being done supports improvement in the memory and all of that. Includes like crossword puzzle.
Mm-hmm.
But not everybody likes to play that kind of mental activity.
Mm-hmm.
So then there is what we do in terms of calculation numbers. So we encourage some of our caregivers and their patients to, take a walk in the mall, look at the numbers, because some of them like to go shopping as long as they don't buy things.
Mm-hmm.
They look at the numbers and they mentally calculate, is this cheap or not cheap, based on the price tags of. So that in a way it is a mental exercise.
Very
that can be-
important.
because
Interesting.
it becomes part of our daily activity anyway. For some people on their weekends they do those kind of things.
So basically what you're saying is if there was an earlier intervention and diagnosis, the family members, long before it's too late,
Correct.
could start really working on these prompts, and they would have scripts. They could get
Right.
some coaching themselves on
Right.
what to do
Right.
with their parents or other loved ones to really stimulate that brain activity.
Exactly. And then there is also like maintaining healthy habits, like eating good diet, healthy
Right.
micronutrients that would enhance your body. Now everybody is thinking about the effect of micronutrients on body cells. And I think studies are just being done in that direction, but it doesn't hurt to maintain a healthy diet. And also exercise is very important in terms of its relationship to our ability to think, and it gives you a natural sense of well-being when you do exercise.
Right.
Not necessarily vigorous exercise, just
Up and moving.
up and moving,
Right.
and that is really very, very
Right.
healthy.
So we've discussed that with many of our other guests. It depends on disease, but one thing that's really common to everything is really exercise and really having a good, well-balanced diet.
Right, exactly. What's happening to some family caregivers is because of stress, and they don't know how to manage stress. They end up picking up negative health habits like smoking, drinking,
Right.
alone, because they're isolated to a
Right.
certain extent. When the condition of their loved ones deteriorate, they feel sometimes embarrassed because they don't know how the person would behave in a social function. So they kind of turn down invitations and end up really isolating themselves. And by doing that, really, it is, it's not going to help them at all, because they remove themselves from possible social support that they could have
Right.
used. So the tip there is for them to kind of, if they need respite, they need to get somebody to stay with their loved ones, and they
Right.
should continue their social meetings with friends,
Right.
families, and if they have family members, instead of going out, invite them to their own home environment,
Right.
but not overwhelm the patient, because with too many people, individual with dementia gets restless and overwhelmed.
So that would seem like it would take a lot of planning. Tell us how you coach people around that.
I think the caregivers we need to recognize that caregivers are the experts in the things that they do.
Right.
One, secondly, they know their loved ones with dementia better than anyone else. They know the preferences, they know what triggers the stress on the patient's part as well as on their part. So we work in coaching them, we really work individually with these caregivers to identify what could they possibly and realistically do
Right.
to help themselves minimize the stress that they're dealing with. But all across the board, we teach them deep breathing exercise because it can be done anytime. You know, when they're so stressed, as long as they are aware of their feelings and stress at that
Right.
time, they need to take a 2 minutes break and do a deep breathing in another room and then come back
Right.
to work with their loved ones again. But sometimes it is very hard for them to really just take a time break.
Right.
Yeah.
I think what we're learning from Elizabeth in this regard is that not only does there need to be a care plan for the person that's diagnosed with dementia, Alzheimer's, you need a care plan too, as the caregiver. So it's not just assuming the responsibilities, readjusting your life, and then just going forward and trying to do the best you can with really very few resources. She's talking about how you actually plan and you go out and you reach out for other resources so that you're not doing this alone. You try to, be sure that you're not decreasing your social contact so that you do have the social contact that you really need to keep yourself going. Now, did this kind of information come out of your study? Tell us about your research and what you're doing currently.
The study that I did was to do an intervention program to improve the caregivers' resourceful skills. And resourceful skills includes cognitively reframing, and this term is a little bit complex just listening to it, but let me simplify that by saying that because of the stressors that caregivers are confronted with at home, this could be behavior problems, or it could be complexity in physical care, that if they don't understand why is the patient behaving this way, they'll take all of this personally. But if they understand the disease itself, because it is part of the disease, the person can be very agitated, assaultive sometimes, insulting sometimes, and caregivers take that personally.
Right.
So if they reframe that this is part of the disease, they won't take that personally, and so they can regulate how they feel. Instead of being angry or anxious, then they'll say, this is part of the disease. So I can deal with this and I can handle it differently.
Right.
And in our intervention, we ask them to identify what strategies will work for them. We're not telling them how to do it, but we'll ask them based on their past experience of dealing with some similar problems. We focus on optimism, which is really based on their successful way of managing some problems that they encountered in the past, that this is something that they can handle too. If they handled it in the past, something different,
Right.
this is something that they can
Right.
reinvent and do again. So they develop these strategies.
That's a very good approach.
And they implement and they evaluate to see if it works or not.
Right. So it sounds like part of what you've studied is that you've got to have that conversation with the caregiver.
Exactly.
The caregiver can't be just sitting at home talking to yourself and just trying to come up with all this. Really having someone working with you and sort of giving you the prompts so that you can think about how to customize this. Tell us about some of the novel approaches people have used not to personalize and take to heart what they're hearing someone else say, because it's really the disease talking, not necessarily the person talking.
Right.
But what kind of things did people come up with?
Well, a good number of them, because one of the modules in our intervention is really sharing with them knowledge about the disease itself and what to expect. So they're kind of anticipating this already, because in their mind this is part of the disease. They would say they feel so empowered. They were able to call the Alzheimer's associations to ask, what are the resources that you can offer me? Because I have a husband or a mother with Alzheimer's disease. I need to know what is in my community that I can access to. They never had the a good sense about themselves to be knowledgeable enough to ask those questions. So they were intimidated to call the organization, but now after these programs, they feel like, I can do this. So, there's like few caregivers in my groups would say, you should be proud of us. I did call Alzheimer's Association, which I never would have done before, to ask what are available resources that they can access to.
Right, but I hear two things that you're saying, which I think, again, is important for our listeners to pay attention to. It's not only finding out what the resources are, but it's feeling like it's all about you. That's what they're there for. They want you to call. That's what you have to do. You have to reach out. No one can reach out for you. So you have to feel that empowerment, as you've been calling it, to really take advantage of that and sort of put it together for yourself.
Right. Yeah, exactly. The other thing that was interesting that I found in my study was the group that received the intervention. After 6 months, after 6 weeks, when the intervention was over, they were more anxious than the control group.
And the control group was people that did
not get the intervention. And
say that again. The study group, the people that you were giving this program to, was actually
their anxiety score went up.
Their anxiety score went up. So it was that you didn't expect that.
I didn't expect that.
So now that's the great part about being a researcher. You don't know what you're going to get.
Well, but there's an explanation to that. I think. As people learn more about the disease that they're dealing with, they become more anxious. That's why those individuals who receive the training packet that includes knowledge about Alzheimer's became more anxious than the ones who did not have more knowledge.
So do we interpret that as ignorance is bliss, or is it that because they have information, they sort of know what's coming, and it could be overwhelming?
Right. It is. And also, I think the timing of when we collected our data was almost like at the end, on the last week of the intervention training, or 1 week after. So it is the separation from the group that might trigger also their feelings of anxiety now that they have to do it alone, because in the past, when they were still on the program, every week they come, they're so happy, there's that almost like a support group for them that they can share what happened the previous week. What was the effect of their strategies? Did it work or didn't it work? They get some feedback. They get some expertise from other caregivers in terms of, you should try this and try that. So I think that's also a possible reason why their anxiety went up, because of the termination of the training program.
Right, so I think the explanation that Dr. Gonzalez is sharing with us is that maybe the anxiety went up because people got so much out of this group approach and having that feedback from one another, that the idea that they wouldn't have that would make you anxious. I mean, anyone who has gotten very used to this and is isolated, this group could be the most important thing happening for them. So I guess the question is more about that finding is not necessarily related to knowledge, knowing more about the illness. It's related to the dynamics of the group in a good way, and that it just shows that you really need these support groups.
Right. Well, but that's really two we really don't know, but those are the two possible explanations that I could offer why the anxiety went up. But I also know that in some other studies, not in my particular study, that the more knowledgeable the caregivers are, the more anxious they are. So I think there is something to be said in terms of knowing about the disease, because it is a devastating disease.
It is. It's
not only for the patient, but for the family members involved in it. And so it's, I think, when you think about the progressive deterioration, the loss of individual personality there, loss of identity to a certain extent, that is scary to a lot of people, and that is anxiety provoking in and of itself.
Well, part of what we want to focus on, and maybe we could sort of put this together in terms of what are the tips, so that our show is around not having have a toll on
Right,
the
right.
caregiver.
Right.
So what kinds of tips? You've already given us some. You need support. You need not to be isolated. Information may make you more anxious, but information at least gives you a pathway to what you
Right.
need to do.
Exactly.
So it's not necessarily anxiety where you're immobilized, you can't
Correct.
do anything.
Correct.
It's more like being very alert.
Correct.
That you have to do
Correct.
certain things.
Correct.
You've got to make certain plans. What other tips would you tell us?
The other components to this would be actually making sure that you talk to your loved ones when the person is still able to communicate their preferences to you. Early on, as a matter of fact, that's why early screening and early diagnosis is very important so that families can prepare
Right.
and comply with the preference of the person who has dementia. Otherwise, if you delay that dialogue, the person might not be able to communicate their preferences anymore. So
Right.
everybody gets burdened by making those decisions that they don't know whether it's what is right or what
Right.
the person doesn't want to do.
Right.
So I think it's very important to have early conversation, and this is linked to early screening when there is already symptoms of dementia. Even the diagnosis is not sure. I think families should start talking about, estate planning, preferences of the
Right.
person, and all of that needs to come into play, whether the person would like to be institutionalized if time comes, or some people would like to be taken care of at home, where the family is, and just have somebody come and take care of them.
I think that is a superb point, Elizabeth, because when someone is literally looking forward to losing their mind, it's not something that is pleasant or easy to talk about. But if you at least have that conversation, that person's still aware enough that they can be a player in their own determination of what they want. And the family's role is to really help them to get there. So it's very different later on when you're really taking care of that person when they can't remember who you are, or they're combative with you or other family members. You can't have those conversations then. So I think that the biggest tip that you gave us with all these tips is the early intervention. And I think that you gave us a great segue for many people that are listening to this show. When people that you know and love are starting to forget the big things, not the little things, the important things, time, place, things that could put them in danger, these are warning signs. And you don't want to be the kind of person that's waiting 3 years to have that conversation with your doctor or treatment team so that that person can help you get that early evaluation. If you could say within 6 months, I think I've noticed these kinds of changes, I think we should really have that conversation. The worst is that you could be wrong. I mean, how bad is that? You could find out, no, it's not a problem. But really to have that comfort level in having the discussion really gives you a jump start in some cases of a couple of years to do the right planning, to do the right thing. So I think that that is the biggest takeaway from this show. Would you agree?
Yes, that's true. I have another one that I think everybody should keep in mind. Caregivers oftentimes do not ask help, even if they really need it,
Right.
because they think that they can do it all.
Right.
I think it is very important early on when any person assumes the responsibility of being a caregiver to a loved one or a person with dementia in particular, that time will come that they will need help, and they should
Right.
early on get a list of resources in the community where they live, so
Right.
that when they need it, it is just a phone call away.
I think that's great, but see, that early intervention will give you that lead time to really create your own village. I want to
Right.
thank Dr. Gonzalez for being our guest today. With her background as a PhD and registered nurse, she both is a scientist and she's practical, as nurses tend to be. And she's really helped us to understand those pathways, how we can really plant the seeds so that we can do the best job with our given assignment in taking care of someone that we love and we want to really have a good life for them. I hope that you've learned something in the show today that you can take with you or you can share with other people that you know. I want to thank you for being with us today, and remember, with health, all things are possible. Thank you and have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.